Talk a little bit more about public services, and let's talk about the NHS, because that is going to be one of the key battlegrounds next May at the general election. And both Labour and the Conservative-led government have promised more money for the NHS. Let's talk to a local GP, Avi Bhatia, about what that could mean for him here. Is that the sort of money that you are looking for to improve clinical services here in the area?
I think any form of increased funding for the NHS is always going to be useful. We would caveat that slightly against the increased demand for services that we're seeing both in the hospital and in primary care. Certainly the extra funding will always be useful. We at NHS Erewash look towards primary care to try and improve it. It will help us improve access to services. It will help us improve perhaps the capacity we have to deliver care for patients, and it will help us to improve perhaps deliver care to those patients in the community who have multiple comorbidities, lots of things wrong with them, who are now living longer and having more issues.
Is there a crisis in the NHS and in accident and emergency in your view?
I think the NHS is very stretched at the moment. I think everybody who works in the NHS works exceptionally hard, goes often above the call of duty. There's an increased demand which is ever increasing on the services. We need to perhaps look at ways of working better, more efficiently, but additional resource is always going to be useful to help that situation.
Avi Bhatia, thank you very much. And with that, it's goodbye from the Bombardier factory in Derby. And back to you, Andrew, in London.